My name is Dana Valletta, and today we're going to talk some about cystic fibrosis in infants. Cystic fibrosis is a genetic condition. It's carried by every 1 in 29 people. It would take 1 in 29 person to meet a 1 in 29 person, and then they would have a 1 in 4 chance of having a child with cystic fibrosis. People with cystic fibrosis have an inability to move sodium and chloride electrolytes through their cells correctly, primarily in their sinuses, lungs, intestines, pancreas, and in their sweat glands. This improper movement of sodium and chloride electrolytes makes them have thick, sticky mucus in all those areas. In your sinuses, they can have long-term sinusitis and infections. In their lungs, they can have recurrent episodes of pneumonia and chronic lung damage, which is generally the demise of people with cystic fibrosis. In their intestines, and it can cause intestinal mucus that makes their bowels become blocked. In their pancreas, it makes them have issues with diabetes, and they can also have problems where the blockage of the pancreas does not allow them to have fat absorption of calories. So it impacts both their lungs, their sinuses, their intestines, and their overall nutritional status. The treatments of cystic fibrosis are generally related and interfering in the way that those things are impacted. In young infants, their therapies start as soon as they're diagnosed. We generally in this state have newborn screening and have babies diagnosed before they're a month of age. When those children are diagnosed, they start with salt supplementation because they have wasting of salt in their body. We start them with breathing treatments to move the mucus around in their lungs so they don't have recurrent lung damage. And one of the biggest impacts with cystic fibrosis in the past few years is knowing that the sooner you find it and the sooner you intervene before people develop symptoms, the longer and healthier someone's entire life can be. When we do things with newborn screening in this state, all of our aims are having someone to be a healthy adult that can lead a healthy life, but it all starts with a strong foundation from the very beginning of early diagnosis and early therapies. Some of those therapies are directed specifically at their nutrition with vitamin supplementation and extra calories. It would not be unusual for an infant with cystic fibrosis to require 20 to 30% extra calories just to help them grow to a normal level. When we used to see babies that weren't diagnosed through newborn screening, they would have recurrent episodes of pneumonia, so they would have lung damage on a continual basis, or they had failed to physically grow, so they were damaging their lung tissue and not developing healthy lung tissue because of their poor nutritional status. Now when we see babies with cystic fibrosis, they're at a completely different level. It's a healthy baby with a genetic condition that needs intervention.